Do you ever notice a part of your skin suddenly getting red, warm, and swollen, maybe on your leg or arm? And it's a bit painful when you touch it. That might not just be a simple rash. It could be a common but serious skin infection called cellulitis. Think about the last time you had a small cut or a scrape. Did it get worse instead of better? Cellulitis happens when bacteria sneak through broken skin and cause infection underneath. It's not rare. Many people get it without realizing at first. It can spread quickly if ignored. So, if your skin is angry, red, and painful, your body might be yelling for help. Isn't it better to understand what's happening early? What exactly causes cellulitis? Let's say you were gardening and got a tiny thorn prick on your finger. That small opening in the skin is like an unlocked door for bacteria. The usual culprits are bacteria called Streptococcus and Staphylococcus. They live on your skin or in the environment. Once they enter through cuts, insect bites, or even dry, cracked skin, they multiply and cause infection. Imagine leaving your kitchen window open during a fly season. Bugs get in, right? It's similar. Any tiny break in the skin can let bacteria in. People with diabetes or poor circulation are more at risk because their bodies don't fight germs as well. So, ever ignored a blister or a hangnail? That could be your body's weak spot. Imagine waking up and noticing your lower leg is red, feels hot, and hurts when you walk. The red area might be spreading, like spilling red ink on a napkin. It's not itchy like an allergy. It's tender, swollen, and warm. You might also feel feverish or tired, as if you're coming down with the flu. Some people say it feels like a bad sunburn, but deeper. Now think, did the area start after a small injury? Is it growing larger each day? Those are big red flags, literally. Unlike a bruise, which changes color over time, cellulitis keeps getting redder and more painful. If you press on it, it won't turn white easily. Your body is fighting, but it needs help soon. How do doctors know it's cellulitis and not something else? They don't need fancy machines. Usually they look at your skin and ask about recent injuries or cuts. Is the redness spreading? Do you have a fever? That helps them decide. There's no blood test or scan needed in most cases. But if you've had cellulitis before or it's severe, they might take blood or check for antibiotic resistance. Treatment: antibiotics, either pills or sometimes IV if it's bad. Imagine antibiotics as backup soldiers sent to fight the germs. You usually start feeling better in 2 to 3 days. But, and this is important, you must finish all the medicine, even if the redness fades. Quitting early is like stopping a war halfway. The enemy can come back stronger. Follow up with the doctor is key to make sure the infection is gone. Can you stop cellulitis before it starts? Yes, think of it like locking your doors at night. Clean any cut or scrape right away with soap and water. Apply an antiseptic and cover it with a bandage. Moisturize dry skin to prevent cracks. If you have athlete's foot or swollen legs, treat them. Fungus or swelling can create entry points. People with diabetes should check their feet daily. A tiny sore can turn into cellulitis fast. Wear gloves while gardening or doing dishes. Use lotion to avoid cracked hands. It's not about being overly clean, it's about being smart. Small habits protect big health. So next time you get a paper cut, will you just ignore it or take 30 seconds to protect yourself? Scientists are always working to improve how we fight infections like cellulitis. One recent focus is on smart antibiotics, medicines that can better target the specific bacteria causing the infection without harming good bacteria. Some hospitals now use rapid skin swab tests to see if the germs are resistant to common drugs. Another advance is studying why some people get cellulitis again and again. Turns out, sometimes the lymph system, which fights infection, gets damaged after the first episode. New research is testing whether special compression wraps or early IV antibiotics can prevent repeat cases. Imagine a future where your doctor can predict your risk and stop cellulitis before it starts. That's where science is heading. Cool, right.